Embracing home care, a comforting choice. Home care is a lifeline for many. It allows individuals to receive care in the comfort of their own homes. This can be a reassuring alternative to assisted living facilities. Home care services can range from help with daily tasks to skilled medical care. Understanding the costs associated with home care is crucial. This knowledge empowers individuals and families to make informed decisions. Planning for home care costs can be overwhelming, but it doesn't have to be. We'll break down the intricacies of home care costs. By understanding these costs, you can ensure your loved ones receive the care they need. Let's embark on this journey of understanding and planning together. Factors shaping home care costs, a closer look. Several factors influence the cost of home care. The level of care required is a major determinant. Other factors include agency fees, insurance coverage, and out-of-pocket expenses. Each element plays a significant role in shaping the overall cost. The type and frequency of care needed influence costs. Basic assistance with daily tasks will cost less than skilled nursing care. Geographic location also matters, as home care costs can vary from state to state. Understanding these cost drivers is vital. It empowers individuals and families to make informed decisions. By carefully evaluating these factors, you can plan for home care expenses effectively. Navigating levels of care, finding the right fit. The level of care required directly impacts home care costs. Home care services cater to a wide spectrum of needs. These needs range from companionship and meal preparation to complex medical care. Companionship services offer social interaction and assistance with light tasks. Homemaker services focus on household duties like cleaning and laundry. Home health aides provide personal care, such as bathing and dressing. Skilled nursing care involves medical procedures like wound care and medication management. It's crucial to assess the specific care needs of your loved one. This assessment helps determine the appropriate level of care. A clear understanding of care needs enables you to choose the right services. This in turn allows you to manage costs effectively. Decoding agency fees. Transparency is key. When you opt for home care through an agency, you'll encounter agency fees. These fees cover the agency's operational costs, including staff recruitment, training, and insurance. Agency fees can vary depending on the agency's reputation, location, and services offered. It's essential to inquire about agency fees up front. Transparency is key when selecting a home care agency. Request a detailed breakdown of their fee structure. This ensures clarity and helps you make an informed decision. Don't hesitate to compare fees from different agencies. This comparison will help you find a balance between quality care and affordability. Remember, understanding agency fees is crucial for effective budget planning. Unlocking insurance coverage. Maximizing benefits. Insurance coverage can play a vital role in offsetting home care costs. Explore different insurance options, including long-term care insurance, health insurance, and Medicare. Long-term care insurance is specifically designed to cover long-term care services, including home care. Health insurance policies may offer limited coverage for home care, particularly if it's deemed medically necessary. Medicare, the federal health insurance program for seniors, provides coverage for skilled home health care under specific conditions. Review your insurance policies carefully to understand the extent of home care coverage. Contact your insurance provider to clarify any doubts and maximize your benefits. Understanding your insurance coverage can significantly reduce your out-of-pocket expenses. Exploring financial assistance. Tapping into resources. For individuals facing financial constraints, several financial assistance programs can help cover home care costs. Medicaid, a joint federal and state program, provides health coverage to low-income individuals, including long-term care services. The Department of Veterans Affairs, or VA, offers aid and attendance benefits to veterans and their surviving spouses who require assistance with daily activities. Local government agencies and non-profit organizations may also provide financial assistance or subsidies for home care services. Research and explore these financial assistance options thoroughly. Contact the relevant agencies to determine your eligibility and access the support you deserve. Don't let financial limitations prevent your loved ones from receiving essential care. Budgeting for home care, planning for peace of mind. Developing a comprehensive budget is crucial for managing home care expenses. Start by assessing your income, assets, and expenses. This assessment will provide a clear picture of your financial situation. Factor in the estimated costs of home care based on the level of care needed and agency fees. Explore potential insurance coverage and financial assistance options to determine the amount you might need to cover out of pocket. Create a realistic budget that aligns with your financial capabilities. Consider ways to reduce expenses or increase income if needed. Remember, a well-planned budget brings peace of mind and ensures sustainable care for your loved one. Signal Health Group, your trusted partner in home care. Signal Health Group is a reputable provider of comprehensive home care solutions. With a focus on personalized care and exceptional service, Signal Health Group assists families in navigating the complexities of home care. Their team of experienced professionals provides guidance on care options, financial assistance, and insurance navigation. Signal Health Group acts as a reliable advocate, ensuring your loved one receives the highest standard of care while maximizing cost effectiveness. Their commitment to transparency, compassion, and individualized care makes them a trusted partner in navigating the home care journey. Planning ahead. Securing a brighter future. Planning for home care costs is an investment in your loved one's well-being and your peace of mind. Start planning early, even if home care isn't an immediate need. This proactive approach allows you to explore options, assess financial resources, and make informed decisions. Consult with financial advisors, elder law attorneys, and home care experts to develop a comprehensive care plan. Communicate openly with family members to ensure everyone is informed and involved in the decision-making process. Remember, knowledge is power. By understanding the costs, resources, and options available, you can approach home care with confidence and provide your loved one with the best possible care in the comfort of their own home.